Interestingly, we have a 32 years old patient. She's suffering from chronic bleeding and excessive bleeding each period and sometimes between period and another. And what you have seen right now is a hysteroscopy. And as you see, when we get inside, we can see here, this is what we call it the inner lining. And this is what we call it the fundus area, where it is the most roomy area where we can put the embryos here. And if we go deeper to see by magnification, can we see all this is pus? It looks like sesames, but it is all of this is just blood cells or just glands which increase the blood into the cavity each period or sometimes period and another. We call that a sign of adenomyosis. Adeno in the Latin words means a gland, and a meiosis is the muscle of the womb. And that is called the adenomyosis. It's a type of endometriosis which is start to be spreading. We can remove it by endoscopy, and we can remove it sometimes if it's very excessive by open surgery. If we go through this and we look to this area, this is the tube entrance. This is the entrance of the tube. And if we go to the other area here, this is the entrance of the other tube here in this area. And those are the tubes where the ovums come. And the ovum, when it comes, it meets the sperm, and then the baby is implanted here. Look at this. All of this is some kind of like what we call an endometrial lining, which is excessive, kind of like small polyps, but it looks fine. But the most important and characteristic thing is that, as you see, the sesame-like appearance of the adenomyosis. Thank you so much.